Diet is very important during pregnancy, which is not to say that if you don't eat a perfect diet, you won't have a healthy baby. Obviously you will. But there are certain foods that we want you to eat and we want you to pay attention to, and certain foods that we want you to also be careful and avoid. So, for instance, your overall diet, we aim for a certain weight gain during pregnancy. So you want to gain, the average person who comes in who's average weight, we want to gain between 25 and 35 pounds. Patients who are underweight, we may want them to gain a little bit more. Patients who are overweight, a little bit less. But for the average weight patient, 25 to 35 is perfect. I don't like to drive people crazy with their weight. Patients sometimes focus too much on it and then they become food obsessed, and that's never a good thing. So I generally say eat to hunger. The actual calories per day is about 300 calories per day more than you would eat when you're not pregnant. But again, I don't like people to focus overly on that because I think it can become too much of a thing for them, and then they focus too much on the actual weight, the actual calories, and not what they're eating. So eating at hunger is always a good way to sort of balance their diet. The other thing is that in early pregnancy, people have a lot of food aversions, and couples will come in, the wife can't eat anything, she's like nauseated, everything that's ordinarily healthy she can't go near, she won't eat a protein, she won't eat a fruit, she won't eat a vegetable, all the things that you would ordinarily want to eat, she won't go near them, and the husband's all freaking out that she's eating bagels and bananas and nothing else. And in the beginning of pregnancy, you've got a baby that's this large, you don't have to get crazy about what you're eating, and I always say to them, eat what stays down. You know, anything calorie-wise is better than trying to force something that's going to come up and you won't do well.